In 2023, a patient walked out of a clinic holding two prescriptions. Both were completely legal. Both were approved by regulators. Both had been handed to millions of people before, without a second thought. Within hours, that patient's temperature had soared past 41 degrees. Their muscles locked rigid. Their heart raced beyond anything a resting body should ever reach. And a team of doctors stood over them, fighting to save a person who had done nothing but follow instructions. The part that should stop you cold? Neither medicine was dangerous on its own. I'm a pharmacist. This is exactly the kind of hidden interaction I'm trained to catch before it ever reaches you. And today, I'm going to show you how two safe drugs can become a poison. One clarification first, because it matters. Not every painkiller behaves this way, but some do. This is the story of specific combinations, not every antidepressant and every painkiller. So what were these two ordinary medicines sitting harmless in a hand? The first was an antidepressant, one of the most prescribed medicines on the planet, taken by tens of millions of people to steady the mind and quiet the darkness. It works slowly and quietly by lifting the level of a single chemical messenger in the brain, one you've heard of before, serotonin. The second was a painkiller, not an exotic one, a moderate, everyday opioid, handed out for back pain, dental pain, injuries, the kind of prescription that feels almost routine. But this particular painkiller hides a secret most patients are never told. It doesn't only silence pain, it quietly pushes that exact same chemical messenger upward. Two drugs, one chemical, both pushing the same direction. But if each one only nudges serotonin gently, how does that ever turn deadly? Picture a sink. Serotonin is the water. Normally, the tap runs gently, the drain clears it away, and the level stays exactly where the body wants it. The antidepressant narrows that drain, so a little more serotonin stays behind. That's the whole point. That's how it heals. But the painkiller attacks the balance from a second angle. It opens the tap wider, at the very moment the drain is already narrowed. And now, the water has nowhere to go but up. Within hours, receptors that should fire now and then begin firing relentlessly. The nervous system starts to scream. This is the moment medicine stops being medicine, and it has a name, one you'll never ignore on a label again. So what does it actually feel like as it takes hold of a living body? It's called serotonin syndrome, and it arrives in three waves. The first wave is the mind. Agitation, confusion, a restlessness the patient can't explain, as if their thoughts are outrunning the room. Easy to dismiss, easy to blame on stress, on the pain, on the anxiety the antidepressant was meant to treat. And that is exactly what makes it so cruel. The first warning sign looks like the very thing you were trying to fix. The second wave is the nerves. Muscles twitch and jerk on their own. Reflexes sharpen to a hair trigger. The body trembles, then shakes. And still, most people wait, because who calls an ambulance over the shakes? The third wave is the one that kills. The body's thermostat breaks. Temperature climbs past 40 degrees and keeps rising. Muscles clench so violently they begin to break down and poison the blood. The heart races, the organs strain, and a healthy person can slide toward death in a matter of hours. All from two pills a pharmacy handed over without alarm. So if this reaction is real, and it's known, why on earth does it keep happening? Here's the uncomfortable truth. The painkiller and the antidepressant are often prescribed by two different people. A family doctor manages the low mood. A dentist, a surgeon, an emergency clinician handles the pain. Neither always sees the other's list, and the patient, the one person who swallows both, usually has no idea the two share a hidden chemistry. Ask yourself this. The last time you were handed a prescription, did anyone ask for the full list of everything else you take? Sometimes, yes. Often, in a rushed appointment, no. And that gap, that small silence between two prescriptions, is exactly where this reaction is born. It isn't the story of a bad drug. Both are good drugs. It's the story of two safe things meeting in a place no one was watching. So how do you protect yourself without fearing medicine you may genuinely need? The answer is smaller than the danger makes it sound. You don't stop your antidepressant. You don't refuse pain relief. You do the one thing the system so often forgets to do for you. You make sure a single person sees the whole picture. Tell every prescriber everything you take, the painkiller, the antidepressant, anything over the counter. And when a new prescription lands in your hand, ask one sentence out loud. Does this interact with anything I'm already on? As a pharmacist, I can check two medicines against each other in seconds. That one question, asked at the counter before the very first dose, is the difference between a routine prescription and a hospital bed. Because the most dangerous drugs aren't always the ones marked with a skull. Sometimes they're the two ordinary pills sitting quietly in your hand, perfectly safe, perfectly legal, and perfectly capable of turning on you the moment nobody's looking. If two different doctors have ever handed you two different prescriptions, tell me below whether anyone checked them against each other. You'll be surprised how many people say no.